Welcome to Kaniksu Community Health. Our mission is to provide our communities with quality, accessible, and affordable care. In doing so, we offer our communities a comprehensive list of healthcare services including family medicine, pediatrics, behavioral health, and dental. This mission began in 2002 as the Boundary Regional Community Health Center in Bonners Ferry, Idaho. The clinic operated with the belief that every person, regardless of their circumstances, should have access to quality and affordable healthcare. As the community grew, so did the dream, and in 2011, Boundary Regional Community Health became Kaniksu Health Services. A new Bonners Ferry clinic was built to better serve our patients, and being truly accessible meant we needed to add new locations and extended hours. This same year, we acquired new clinics in Sandpoint and Priest River, Idaho, expanding our reach into Bonner County. In 2015, we rounded out our service offerings with the addition of Sandpoint Pediatrics. Then, in January 2022, we opened our new purpose-built clinic in Sandpoint, offering family medicine, pediatrics, behavioral health, dental, a same-day clinic, and pharmacy services, all under one roof. And in 2024, we opened our Sandpoint Behavioral Health Clinic and a standalone pharmacy next to our Bonners Ferry Clinic. With our service areas and accessibility covered, we focus on making sure our quality of care not only met, but exceeded standards. In 2016, we achieved PCMH Level 3 status in all clinic locations and were ranked as the second highest CHC for quality in the state of Idaho. And each year since 2020, we have received a Gold Award for quality from HRSA, ranking us in the top 10% of all health centers in the U.S. Over the years, we have continued to meet the needs of our community by adding a number of programs including an outpatient opiate addiction and substance abuse therapy program, on-site behavioral health services for all students within the Bonner and Boundary County schools, medication assistance through the 340B program, a clinical pharmacist, care management, outreach and enrollment specialists to aid patients in navigating all aspects of insurance, and patient assistance specialists who work with patients to find local resources for their health care and life needs. In order to remain a vital part of the community, we believe that an organization must maintain strong community partnerships. With this in mind, we have created lasting relationships with organizations and individuals that has strengthened our role as the leading healthcare provider in North Idaho, committed to improving the lives of our community members. After 23 years, making quality and affordable healthcare accessible to everyone is still what drives us every day. As we looked back over the years, the growth, and all the changes, we realized it was time our name and look reflect who we have become and who we will be into the future. With this in mind, we rebranded once again and became Kaniksu Community Health. It was a small change to our name, but a significant representation of who we had become. A vital healthcare organization that puts its community at the center of everything we do. The service area of Kaniksu Community Health includes Boundary and Bonner counties in the northern panhandle of Idaho. Our target population is the low-income, uninsured, and underinsured individuals in the area, including those with Medicaid and Medicare coverage. An estimated 41% of the population live at or below 200% of the federal poverty level. We have 4 primary care clinical delivery sites serving over 20,000 patients in the cities of Sandpoint, Bonners Ferry, and Priest River. Although a small percentage of the patient population are fully insured, over 80% of the population is needy or at risk. In the past few years, our challenges have centered around 4 main areas: access to women's health services, Medicaid uncertainties, attacks on the 340B program, and a shortage of mental health providers. In 2023, our local hospital, Bonner General Health, made the difficult decision to close their labor and delivery department, which led to the departure of all but one mid-level women's health provider. Without access to local services, pregnant women were forced to drive at least 45 miles one way to access women's health services at Kootenai Hospital. This also meant many patients created a relationship with the pediatric providers associated with the hospital, and we saw our pediatric population decline. Through relationship building, strong marketing initiatives, and continued demonstration of our unwavering commitment to our community, we slowly saw those numbers return to previous levels. In recent years, we have faced significant Medicaid challenges at both the state and federal levels, including financial instability due to redeterminations and reimbursement rates, workforce shortages, and increased demand for behavioral health services, impacting our ability to provide comprehensive care. Through our participation with the Idaho Community Health Center Association, we have been focusing on building relationships with our elected officials and, at times, successfully advocating on behalf of Kaniksu Community Health and all Idaho CHCs. Big Pharma's attacks on the 340B program, including contract pharmacy restrictions, legislative changes, the rebate model, reporting requirements, and more, have affected our ability to operate in the program and offer vital medications to our most vulnerable populations. Through strategic planning, compliance efforts, and advocacy, we have been able to mitigate some of the impact. By expanding in-house pharmacy services, leveraging alternative funding opportunities, and engaging in policy advocacy, we have been able to continue to provide essential medications to our communities while navigating the evolving landscape of the 340B program. Idaho continues to grapple with a critical shortage of mental health professionals, with every county designated as a mental health professional shortage area, ultimately impacting access to care and leading to reliance on crisis services. In response to these shortages, we applied for and received a SAMHSA grant as part of the Certified Community Behavioral Health Center program, opened a new behavioral health clinic, and are working through the program to become an official CCBHC. By expanding our mental health services, we were able to increase access by 65% in the first year alone. Idaho is behind much of the U.S. in terms of healthcare. According to America's Health Rankings from the United Health Foundation, Idaho is rated as the least healthy state in the nation, with the least amount of primary care physicians. The transition to value-based care has been challenging in Idaho. The state and payers are moving slowly from fee-for-service to value-based payment models. We are in a number of upside risk models and performing well, but the move to downside risk sharing is precarious, and the suggested models from Medicare and Medicaid are untenable, as there are competing strategies and agendas that ultimately leave the primary care providers with too much downside risk to sustain. In our mind, completing this transformation, while ensuring our value-based contracts allow for continued financial stability, is our main area of risk going forward. While our organization is leading the charge in terms of quality and access to healthcare, being situated within a state that is struggling with rapid population growth, coupled with low health ratings, pose challenges for us as we work to hire staff to meet increased patient demand in a difficult employment market. However, as the healthcare landscape changes and we continue to grow, Kaniksu Community Health remains committed to providing clinical care that is integrative, grounded in relationships, and aligned with personal health goals. This is a whole package for success, and we are honored to partner with our patients on their healthcare journey.